Abby. How are you doing today? My name is
Hi,
Melat, a student nurse from EVCC. Today I'm here to do teaching, patient teaching. And how's she doing today, Ruth? I believe you
she's
are
okay.
her
She's
dad,
she's
right?
okay. How are you doing?
Yeah, good, good. She's
Yeah,
doing
right.
good. She's busy with her work
Yeah, she's watching her video.
videos. That's nice. Okay, I'm gonna go ahead and start patient teaching. I have prepared a PowerPoint. I'm gonna go ahead and share with you. So we're gonna go ahead on the introduction part. So what is Kawasaki disease? It's a syndrome that's acute illness characterized by swelling and inflammation of the walls of blood vessels and throughout the whole body in young children, particularly in those who are the age of 5 years. And the disease mainly affects the coronary arteries responsible for supplying oxygen and rich blood to the heart muscles, thereby interfering with the normal functioning of the heart. So, okay. The initial cases were reported in Japan and across the period throughout the world. And it have a sign and symptoms of with crash and burn. So C stands for the redness of the eye, which is conjunctivitis, and rash and adenopathy is swelling of the lymph nodes. On strawberry tongue, as you see in the picture, it's very red. And hands and feet disclamation, that means peeling of the hands and the feet, as we see in the picture as well. And the fever usually is greater than 102 for more than 5 days. That's a very risk. So that's one of the symptoms that go ahead for treatment. And the causes is not known, and the scientists believe that bacteria and virus may lead to it, and some believe it's genetics. Um, and risk factors are include age which is like under 5, and sex. Mostly it's prominent in boys than girls, and the ethnicity mostly it affects children of Pacific Island and Asian descents. And the diagnosis, there is no specific diagnosis for the disease, but the doctors determine according to the sign and symptoms. The lab tests are also helpful, and the doctors may ask for blood or urine tests. So the early diagnosis is very important because symptoms affecting the heart will be prominent if we are late in diagnosis. So as you see in the picture, since it's going to be the inflammation of blood vessels, here there might be inside the heart, there might be aneurysm because of like the inflammation of the vessels, the coronary vessels. So that leads to have a poor blood exchange. So that's going to be a very poor blood exchange. So that will be weakening of the heart. So oxygen is not coming, like the blood is not coming in and out. So the heart is not getting enough oxygen. Usually, when the heart muscles are getting dying, the kids is like going to have myocardial infarction or heart attack. So that's very serious case. The other is and needs immediately a treatment. So during treatment, the child is admitted to the health facility for 2 to 5 days. The physicians infuses a dosage of intravenous gamma globin and high dose of aspirin for every 6 hours. It's worth nothing that the infusion is only effective if administered within the first 10 days. After discharge, the child should continue taking the high dose of aspirin for around 8 weeks. All right. Do you have any question? I'm sorry.
I don't have any questions. This everything is clear.
Okay, but I want you to teach me back because I want to make sure that you got the points. So can you just give me at least 4 signs and symptoms that we can
Yeah,
be aware of? Mm-hmm.
let me list some points about sinus symptom, cause, and treatment. So let me start from sinus symptom.
Okay.
Sinus symptoms, just one is a conjunctivitis,
Okay.
two is rash,
Okay.
three is adenopathy,
Okay.
strawberry tongue,
Okay.
hand and feet are dystochromatic, and burn and fever. So the
Okay. All
some
right.
of
So
them is the
hands and
standard
feet,
symptom of this. And
disclamation. Yes.
yeah, this one, and then the next one is cause. The cause till now nobody knows that. So unknown,
Okay, the codes.
unknown.
That
The
was
cause
my
is
second
unknown.
question.
So the diagnosis also no specific diagnosis up to now, and the treatment also intravenous gamma globulin medication. So this is some points about
Okay, the
the
treatment.
summary.
Yeah.
Yeah.
So yeah, pretty much that's all about the disease. So if you have any more questions, please let me know. Since you have my phone number and email, I'm going to go ahead and send you some handouts that's like can help you more. That will be for today.
Yeah,
Uh,
everything is okay. Everything is clear. Thank you for
all
teaching
right,
me.
teaching. All right. Okay. Thank
Okay,
you.
bye bye.
Bye. Bye, Root.